Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. Mental illness is something that carries with it, unfortunately, a tremendous stigma. The National Alliance of Mental Illness is trying to do something about it, and that's why its New York City chapter is having its annual walk right here at the Brooklyn Bridge.
The walk was really a wonderful celebration of the NAMI community, and it's a real demonstration that people with mental illness have family and friends and people who care about them.
I'm here supporting my sister
and
my family, you know.
Truly,
so.
you need your family support in order to deal with this.
It started off raining, right? And it became beautiful.
It did.
And that's a great metaphor for mental illness, right?
That is a terrific metaphor because people don't understand that recovery from mental illness is possible. There's real hope, and this was a very physical demonstration of that.
My hope is to bring people together so they can learn about what kind of disabilities we have.
I'm here to support the mentally ill, to let America know that there is nothing wrong with us other than we have chemical imbalance.
NAMI and Fountain House and some other organizations got together and helped produce a PSA, a public service announcement with Glenn Close.
If you could only say what you need to say what you need to say.
1 in 6 adults has a mental illness, and we face a stigma that can be as painful as the disease itself. Change a mind about mental illness, and you can change a life.
How big of a problem is the stigmatization of mental illness?
You know, I think stigma is the biggest problem associated with mental illness. There's a fascinating statistics that 2/3 of the people with a mental health diagnosis don't get the treatment, and people need to understand that treatment for mental illness actually works.
People so often feel totally alone in their mental illness. How does the family get involved?
If families are involved, outcomes, recovery is much more likely.
But the reality is that people often push away their families, right? Don't they?
They do. But that doesn't mean that the family often can't be an important source of information for the provider, for the physician. They know what's going on with their loved ones. A lot of times, people with mental illness are living at home, and nobody knows what's going on with their loved one better than a family member.
One problem is that the person doesn't get help. But then what else goes wrong, right? When the person goes to apply for a job, for example.
The prevalence of mental illness dictates that 1 in 4 people has a mental illness, so the people where you work have a mental illness. There is such significant stigma that I would not recommend that people disclose their mental illness when they're applying for a job. People may not get that job, and if you disclose in the workplace, you might lose that job, and it's really unfortunate.
And is it legal for somebody to ask you about mental illness if they're interviewing you?
It is absolutely not legal to ask whether you have any kind of disability during a job interview. That's an important fact to know.
People who have mental illness have all sorts of other illnesses too, diabetes, hypertension, obesity. They're entitled to have those too, right?
Yes.
And one of the bad things that happens, right, when you have a stigma attached to mental illness is they don't see a doctor, period.
This is a really important issue that you're bringing up. Mental health and physical health are not well integrated. There is a frightening statistic that people with mental illness die on average 25 years earlier from chronic illnesses like heart disease and diabetes, that if they were treated, that wouldn't occur. So it's very important that people with serious and persistent mental illness get the kind of physical health treatment that they need.
And the reason why education is so important is because otherwise people just don't get help, right?
Education is critical. Education is critical for family members and for people with mental illness. First of all, it's important to get rid of those misconceptions, to understand that mental illness is a biological brain disorder. It's also important to learn that treatment works, that people can get the kind of help that they need, and it's not their fault. I've said it's not their fault several times, but it's really important to emphasize that people are not to blame for their mental illness, and they shouldn't be ashamed.